All right, everyone, we might kick off just because we are conscious of everyone's time. So thank you very much for everyone who is joining us this afternoon. For those of you who don't know me, my name's Dee Spink. I'm a Director of Organising in the Public Service team here in the Together office. Many of you would probably know me as well because I have worked for a number of years as the lead organiser with our members in child safety and youth justice. So it's great to have you all here today. We really appreciate your participation. Before we do get started, of course, I'd like to acknowledge the traditional owners of the lands on which we're all meeting across Queensland and pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander members that we might have online with us today as well. So thank you again, everyone, for joining us this afternoon. Of course, the purpose of today's Zoom meeting is to talk about the vaccination mandate and everything that comes with it as well. We know in CHO, as compared to particularly corrections and education, things are a little less clear than they are in some other departments when it comes to who the mandate covers and what that means for you as members and as public sector workers. We are going to try to keep this to half an hour today because we know that your time is precious. For those who haven't been able to make it today as well, we are recording this. So all things going well, we should be able to share this session for your fellow colleagues who might not have been able to join us today too. We know there will be a number of questions and we have had a number of members emailing us, which is great. You know, please continue to keep up that dialogue and send questions through. If you can, for today's Zoom session, it's a lot easier if we can use the Q&A function rather than asking questions in the chat. So we've got Billy, my colleague, here online, as well as my colleague MJ. So we will try to get through as many of those questions as we possibly can. If we can't do that today, we'll make sure that we're obviously going back out to members and saying, what are your questions? What can we put to the department? And I think as well, you know, acknowledging outright that unfortunately there are a lot more questions than there are answers at this stage, but we certainly want to get them on the table with our discussions with the department. But if you do have, you know, if you're having a little bit of trouble using the Q&A section as well, you can certainly put it in the chat too. So obviously we have a very broad range of our members from CHO online today. We are probably unlikely to have many of our youth detention centre members online because we had a separate session with them last week going through exactly this. However, it is a bit more clearer in the case of Cleveland, Brisbane and Westmoreland youth detention centres about the vaccination mandate that is coming from the CHO direction because it's quite clear that it will cover all of those employees. So we have spoken to those members specifically in relation to that. So I do apologise if in our session today it is a little bit confusing because where we're talking about specific dates for first and second vaccinations, that's only for staff who are covered by the CHO mandate. And as you have probably seen from communications from the Director General and other senior departmental staff, there is still question about how far that, there are still a number of questions about how far that reaches into the rest of the department as well. So we do know that any employee who steps foot into a youth detention centre, a school, a hospital, and also a range of other workplaces that are considered high risk settings, that you will be captured by the CHO direction. Very frustratingly, there actually is no CHO direction as yet. So what we are actually talking about today is a series of announcements that have been made by the Premier, by Minister Grace, in Parliament, and also through media statements. So what will happen, but we do not have it as yet, is that the Chief Health Officer will issue a direction regarding mandatory vaccinations for certain employees in high-risk settings. So I do want to say from the outset as well that it is very frustrating that we don't have the official wording around that. So we can give some general advice about what we have seen in other circumstances, but until we actually see the CHO direction, which we are hoping will be, you know, any minute really, it's very difficult for us to provide a lot of specificity. So I do want to just acknowledge that up front, and I appreciate fully that that is frustrating. I noticed just before we started this session as well that the government have issued the direction that relates to what we're calling the pubs and clubs direction, that relates to hospitality venues, which has a number of similar timeframes to the CHO direction that we anticipate will be coming for schools, youth detention centres, correctional centres, but that just hasn't been put out there as yet. So this is what we're dealing with, and it is rather frustrating. So we do want to acknowledge that. So where we are in terms of COVID more broadly is that, you know, and based on the Premier's announcement yesterday about opening borders earlier, so opening borders from Monday the 13th of December, we will be in a different situation than we are today, for instance. So what we know is that currently Queensland essentially has zero COVID. So any change to that is going to be quite significant for Queensland, given that we have had almost 2 years of very limited community exposure. What that means is that, unfortunately, for unvaccinated individuals, that there will be some who get sick, some quite seriously, and that can certainly put a strain on the Queensland health system. Up to this point, a very significant part of the public health directions around minimising the impacts of COVID have been about maximising vaccination. And as most of you would be aware, Queensland is almost, you know, just a hairbreadth off 80% double dosed of our population above the age of 16. Even with that high level, we're not going to get to herd immunity when it comes to COVID. So we do know that there will be COVID circulating in the community once the borders are open. This is a challenge everywhere, including in the places where there is going to be a vaccine mandate. For instance, schools, youth detention centres, particularly because while visitors are also being mandated in terms of if you are unvaccinated, you will not be able to visit you will not be able to visit a youth detention centre, for instance. There are still young people, obviously, in youth detention centres, and there are children in schools as well who are not mandated to have the vaccination. So there will be COVID circulating amongst the community more broadly, but even in, you know, workplaces with a vaccine mandate. So certainly more recently, there has been discussion about the new strain, which it's really too early for us to tell how the Omicron variant will change Queensland and Australia's approach to COVID and what COVID normal means with this variant. But it's simply too early for us to say if it will make people sicker or if it is more transferable. So that's another, you know, wrinkle in what we are talking about today, but we thought it important to acknowledge that as well. So when it comes to the health response in our workplaces, there are a range of ways in which vaccination can be mandated in workplaces in Queensland and in Australia. So what we have seen, oh, sorry, I got a little bit trigger happy there. I apologise about that. What we have seen in some other workplaces, namely Queensland Health and the Queensland Police Service, is that there has been an employer mandate. So we think the employer mandate is most likely the weakest option in terms of the ability to challenge some of these decisions. I'll just put a pin in coming back to talking about the BHP decision as well that was released last week that many of you may be aware of. There is the possibility to legislate a mandate. We haven't seen that as yet. And then there are health directives. So health directives from the Chief Health Officer, which is partly what we're talking about today in terms of the CHO direction for high-risk settings, which captures youth detention centres, schools, corrections. So we've seen two of these options so far. In the Queensland Public Service, the first cab off the rank when it came to a CHO direction were your colleagues in disability services, so accommodation support and respite services. in the Department of DSDS ATSIC. So they do have a health direction in place. We are working through what exactly that means. And I think even as we are speaking right now, there is a meeting with the Director General to talk through what exactly that means for that group of employees. So while there is a CHO direction, we are still working through the implementation of what that means. They are a step ahead of us here in CHO because they do actually have the direction. So we can refer to that direction to say, you know, XYZ employees are covered by this because they meet the criteria of working in a healthcare setting. So they are slightly ahead of us. However, there are still a number of things that need to be worked out through the implementation of that CHO mandate as well. In other states, the use of health directives has been much broader. For instance, in Victoria, if you're an AFL player, you have to be vaccinated, and that's a Chief Health Officer direction as well. So we are seeing varying levels of usage across states. In New South Wales, I believe they have also mandated schools, for instance, through that. So let me just try not to skip through too many of my slides. So some of the circumstances that you might be more au fait with in terms of hearing the Queensland Public Service are employer mandated vaccination. So you might have seen your colleagues in Queensland Health and Queensland Police go through a process a couple of months ago in relation to mandatory vaccination. So that was a decision that was made by the DG of Health and then the Police Commissioner. There was a process that our members and members of other unions who are covered by this went through, a consultation process, which, as we will talk about a little bit later, is a really important part of making sure that employees are consulted about this, that you get as much information as possible. And as we've seen, that's been a really key point as well for employers. If this is something that they want to do, they have to do it properly to ensure that that's not a decision that is going to be challenged. So for our members in Queensland Health and Queensland Police, they had a lot more lead-in time than what we're looking at here for our members in CHO and in education and corrections. So there was a very significant process and quite a significant timeframe attached to that we are simply not seeing as part of this process, unfortunately. And we have now, within the last couple of weeks, seen the Chief Health Officer mandate for public and private health work sites, which includes disability services, so your colleagues in AS and RS. So we do believe that Chief Health Officer mandates are the strongest level of mandate that can be put in place when it comes to workplace mandation of vaccination. With employer mandates, we have seen, while we have seen them challenged, and to circle back to the BHP decision that I mentioned earlier, so the BHP decision has been the only decision in a range of arenas that has actually been challenged through that process. And the reason that it was deemed not a reasonable decision was not the decision to mandate vaccination in and of itself. It was simply because the employer didn't properly consult with its employees. So that's the reason why that fell over for BHP. It wasn't the fact that they had decided to mandate vaccination in the first place. So I think that's important for us to keep in mind, particularly here in CHO, where we may end up with a bit of a hybrid model where some employees are mandated under the Chief Health Officer direction, and it may be that the Director General decides, in order to keep the business running, that they will be seeking to implement an employer mandate. Members would have recalled that a couple of weeks ago, we sent you an email after a meeting with the Director General where that was flagged as a possibility. We just want to confirm as well that there has been no proposal put to us. Things went very quiet after that meeting. Clearly, there were some discussions at a government level about what the Chief Health Officer might be mandating, but there has been no proposal from your employer about extending that at this stage. But we will talk about what happens if that happens as well. So just skip over that one. So we have, certainly from our union's perspective as well, we've clearly been seeking some legal advice about what employer mandates mean for our members. So there is some pretty stringent criteria that needs to be met to ensure that something is considered both lawful and reasonable in terms of a direction around mandated vaccinations. So there are a range of things that must be considered, and I think key for ourselves as a union is making sure that consultation with employees is very much baked into that process. So you are able to have a say about something that is, for some people, you know, a very significant impact on their working lives. So that is incredibly important to us. And then, of course, you know, if your employer does decide that being vaccinated is a part of your employment contract, essentially, that you have access to the vaccination, should you, you know, suffer any side effects from the vaccination as well, that you have either time off or access to work cover or what have you. So those are all very live decisions, or sorry, live discussions that are happening at the moment as well. Oh, I'm so sorry. I don't know why this is. No, it's decided to. No, here we go. Okay. Now, in terms of the roadmap for Queensland, and this is based on what we understand to be the timeframes for staff who are covered by the CHO mandate. So this is only for staff who would be captured by the CHO direction, which, as a reminder, we haven't seen as yet. However, these dates are taken from media statements from the government. So these are largely, also we should say, these are largely driven by school term dates, as the largest number of employees that are covered by this direction are schools-based employees. So that's, you might be wondering about a couple of those dates, but this is what we understand to be the case. Having said that, we still have not seen that CHO direction. So the 10th of December is the last day of school, as many of you would know, and we understand that under the CHO direction, there will be a requirement from the 17th of December, which was the original date that was pegged for the opening of the borders, which was also based on the prediction of 80% of the population aged 16 and above double vaccinated. We believe that from the 17th of December, there will be a requirement for those captured by that directive to have received their first dose of a COVID vaccine. The 23rd of January, which is just before term 1 starts, we understand that may be the date where there is a requirement for a second dose of the vaccine. So once again, and I know, I'm sorry, I probably sound like a broken record, without having seen the CHO direction, it's really hard for us to say that this is definite, but we believe that these are the significant dates that we would have to meet for vaccination there. So I might just pause here before we talk more broadly about what we think needs to occur, particularly when it comes to any sort of employer mandated vaccination, because there is a difference between, as we've talked about today, a significant difference between a CHO mandate, and we've certainly received legal advice that it would be highly unlikely that we would be able to challenge a CHO mandate for areas like youth detention centres and schools. However, we still believe that even if there is a CHO mandate, you as union members in particular should have your say about that decision and there should be consultation with you about the implementation of that. So the slide that we have up now, just for full transparency, this is essentially the claim that we will be putting on the table for all public sector agencies. So not all agencies will be touched or covered by this current CHO directive. In fact, it's quite a few agencies who are covered by the CHO direction. So this is what we will be seeking for our members across the public service, that members have consultation around any vaccine mandates, that there are reasonable timeframes for people to comply with such mandates, a really strong understanding of the scope and the nature of any mandate, and also what is the process for exemptions. Last Monday, and we may have some of our branch conference delegates on the line as well, last Monday, our branch conference delegates had a really significant conversation about not purely looking at COVID vaccine mandates, because yes, that is absolutely a very significant part of the discussion about living with COVID in 2021 and beyond, but that's not the only thing that we need to talk about. And to this point, we really haven't had much, if any, proactive engagement from departments about what does life look like when the borders are open to Queensland and there is COVID in the state, and how do we deal with that? How do we deal with that as a department? How do we deal with that at a service centre level? There's really been no proactive consultation from employers to union members about what that should look like. And it will be a very significant feature of employment in 2022. So we certainly want to be on the front foot and consulting with our members about what you think is reasonable and what you would like to see in terms of consultation. So just to flag this with our members in CHO, because we will be sending an email to all of our members and contacting all of our members this week to ask you some questions about not just COVID vaccination mandates, but also things like having respectful conversations in the workplace about such things, because we know this is an issue that people feel very strongly about. Increased mental health support through this process as well. And then also looking at, obviously, consultation is a very large part of that, and making sure that people are comfortable in having what can be some really challenging conversations as well. So to flag with everyone in CHO and everyone on the line that you will be getting some more communication from us this week and into the next, certainly. And this will not be the last time we speak about the vaccination mandate process, but we do want to hear from you about what you think about, yes, absolutely, what the CHO direction looks like when it does eventually come out, but more broadly, how can we have conversations that are empathetic and we understand everyone's point of view and make sure that your employer is coming along on that ride with us as well. So we'll certainly be contacting our members in CHO and other agencies about that next week. I also wanted to just at this point, put a little bit of a pin in that and then talk about, once the CHO direction is released and we understand the scope of that and who is covered by that, there will certainly need to be some significant discussions around what the exemption process looks like. So for in areas where there is a CHO mandate, so at least part of the departments, we understand that the exemption process will probably be quite limited based on our experience with AS&R. So part of the CHO direction looking at the exemption process is that it really is a very narrow medical contraindication only, essentially, pathway for people who are seeking exemptions. In Queensland Health and Queensland Police, because it was an employer mandated process, not a CHO process, there is a little bit more flexibility around exemptions that the employer might be able to mandate. So that may, depending on how, who is touched and captured by the CHO direction, that may look slightly different, but we do think that under the CHO direction, the exemption process will be much more narrow through there as well. And then, of course, the subsequent question is, what happens once the CHO direction is put in place for staff who decide that they will not get vaccinated, and what happens to them there? And I know that that's a very common question that we're receiving from our members at the moment. There are discussions happening this week with the Public Service Commission because the CHO direction covers a number of departments, so parts of CHO, essentially the whole of the Department of Education, and also corrections. There's also some impact on TAFE as well. So from a union perspective, we are certainly very keen to have a common process across departments when it comes to what happens if an employee decides that they will not be vaccinated, yet at the moment they work in a workplace that requires vaccination. So those discussions are occurring this week. What it looks like what it has looked like in Queensland Health is that once the date for mandatory vaccination was passed, if somebody had not been vaccinated or if they had not disclosed their vaccination status, they were put on leave and asked to show cause for why they shouldn't be subject to a disciplinary process, which can include termination after that process has run its course. So what this will look like, we don't know exactly at this point. As mentioned, there are a number of discussions occurring this week with the Public Service Commission, and we are certainly keen to understand that there is a common process across the agencies that are working under this CHO direction. That is something that, while we may not be able to challenge the CHO direction itself, that doesn't mean that your rights and your entitlements as public sector workers are not defended. And it's certainly a process for our members in Queensland Health and Queensland Police that we're supporting a number of our members individually to work through what that process looks like for them and to support them through that. So while we don't know exactly what that looks like at this point, please be assured, if you are a member, if you are in this category, we will support members through whatever process is decided at that point as well, which we know is, it's quite a confronting conversation, of course. But as a union member, you will always have the support of your union office to go through these processes. And we hope that throughout this week, we will have some further information about what that looks like for those who are covered by the CHO direction. And once again, I apologise for the fact that we've had a bit of a hybrid conversation today, because we know that, very clearly there are some parts of the department, mostly youth detention centres, that are clearly going to be covered by the CHO direction when it's issued. But there are also some parts of the department that, number one, we're not sure, or number two, may or may not be covered by an employer mandate if your employer does come to us at some point and say, here's a proposal, here's what we'd like to talk to you about, which we don't have at this stage. So once again, I do want to emphasise, I know it's very frustrating that there are so many questions at this point and that there is significant uncertainty about that. So as we mentioned, we will be contacting our members this week to ask what you think about not just mandated vaccinations, but other matters in relation to COVID. I can see that there have been some questions coming through and some answers being provided as well. But if we haven't been able to get to your questions today, please contact us. We'll do what we can to follow up from this session as well. But please know that you can always contact the union office. There is absolutely no such thing as a silly question when it comes to this process, because it is a bit of a moving feast at the moment. And I can guarantee you, if you're thinking of a question, that there'll be 100 other members who are thinking of the same thing. So we prefer to receive those questions 5 times over than not at all. So please don't feel shy about coming to us with any questions. We know it is also quite a fraught time for a number of people, and particularly coming at the end of such a really long year for people. So please do be kind to yourself, be kind to your co-workers. It's a really difficult time. It's a very difficult issue to be grappling with as well. Please have your say as union members too. You know, we do want to hear what you think once we send out that email survey as well. And just don't be strangers. You know, please do get in touch with either myself, Billy, Joe, your regional organisers, or just contacting the union office generally, and we'll be able to support you through that, or at least get those questions on the table as well. So I have gone a little bit over half an hour. I apologise. Thank you everyone for your patience, and I do appreciate you sticking in there today. So please look out, keep an eye on your email inbox, and yeah, please don't hesitate to get in touch with us. And this will certainly not be the last time that we're having one of these briefings. I'm sure it may be later this week or early next week once we've got a bit more clarity around what the CHO direction means for CHO. So please keep on checking your emails and being part of the process. So thank you so much for your time today, everyone. And again, for those questions that we haven't been able to get to today, we will follow up about that. And yes, please take care. Thanks, everyone. Bye.